Lupus and the Human Body by Tiffany Williams and Ilan Fan. What is lupus? It is a chronic or long-term inflammatory disease in which the body's immune system attacks its healthy and normal tissues and organs. Lupus is considered an autoimmune disease because the body's defense system is unable to differentiate between healthy cells and foreign cells. The disease can last for years or even lifelong. According to the Lupus Foundation of America, 16,000 new cases of lupus are reported each year. Facts and statistics. Approximately 1.5 million Americans have some form of lupus, and as much as 5 million people are diagnosed with the disease worldwide. Lupus occurs 10 times more often in women than men, especially in women between the ages of 15 to 44. Lupus is also more common in women of African American, Hispanic, and Asian descents. Research shows that 1 in 537 African American women are affected by lupus. 1 in 3 lupus patients suffers multiple autoimmune diseases. There are 4 different forms of lupus. The first form of lupus is systemic lupus, which accounts for 70% of all lupus cases. 50% of these cases affect a major body organ or tissue, such as the heart, lung, kidneys, or brain. The second form of lupus is cutaneous lupus, which accounts for 10% of all lupus cases. This form of lupus affects only the skin. The third form of lupus is drug-induced lupus, which accounts for 10% of all cases and is generally caused by high doses of certain medications. Symptoms of lupus usually subside with the discontinuation of the medications. The last form of lupus is neonatal lupus, which is a rare condition that is caused by the mother's antibodies affecting the fetus. At birth, the baby may have rashes, liver problems, or low blood cell counts. These symptoms usually disappear after 6 months of birth. Signs and symptoms. The average time from the onset of lupus symptoms to diagnosis is around 6 years. Lupus is also known as the great imitator. This is due to the vague symptoms as well as involvement of multiple organ systems which could overlap with other diseases. The most common symptoms of lupus are headaches, extreme fatigue, painful or swollen joints, anemia, edema in feet, legs, or hands, butterfly-shaped rash across cheeks, sunlight sensitivity, and abnormal blood clotting, as well as many other symptoms. Etiology. Causes of lupus are unknown. However, there are potential factors which could trigger the disease, such as genetics, environmental, and medications. One could be born with genes that has higher chances of getting lupus later in life. Lupus often runs in family. However, the chances are very low, ranging from 5% to 13%. There are over 50 genes associated to lupus but are not direct cause of the disease. Environmental factors such as sunlight could trigger lupus. UV light causes damage to cells, triggering the disease and the immune system to attack the sunburn or damaged areas. Infections such as virus could also trigger the disease. People with lupus, once there is an infection, the immune system continues to attack the body even when the virus has been eradicated. Viruses that have been linked to lupus include cytomegalovirus, Epstein-Barr virus, herpes zoster virus, or also known as shingles. Medication factor. Certain drugs causes the immune system to overreact, which causes drug-induced lupus. It is estimated that 50 different drugs are linked to lupus, which include medications for heart diseases, thyroid disease, as well as blood pressure medication. Treatments. There are currently no known cure for lupus. Treatments are for managing the disease. Anti-malarial drugs could be prescribed for conditions concerning skin rash, sores, and blood clots. Immunosuppressive drugs are prescribed to inhibit the activity of the immune system to stop it from attacking healthy tissues and organs. Corticosteroids to counter the inflammation caused by lupus. Non-steroid anti-inflammatory drugs such as ibuprofen to treat pain, swelling, and fever. Other treatments include lifestyle changes such as reducing stress, avoiding trigger-causing environments. Medications and lifestyle changes could prevent swelling, reduce organ and tissue damage, help the immune system, as well as balancing hormones.
As of today, there is still no cure for the disease lupus. Many lupus patients are more susceptible to heart and lung problems later on in life. 1 in 3 patients will develop lupus nephritis. Most patients will experience constant inflammation in all parts of the body, as well as fatal infections. In severe cases, lupus could cause organ damage and organ failure. Lupus could cause discomfort to daily life. However, if the condition is managed properly, a full life is obtainable. With treatments, as much as 80 to 90% of lupus patients are able to live a normal life expectancy. Research shows that most people with the disease have been living with the disease for 40 years. Lupus is thought to develop when a T lymphocyte to an antigen-presenting cell, APC, is introduced. The T cell receptor binds to the major histocompatibility complex, MHC, portion of the APC, which may lead to cytokine release, inflammation, and B cell stimulation. Stimulation of B cell division and the production of immunoglobulin, IgG, autoantibodies that can cause tissue damage also occur in lupus. Recent research shows that bacteria in the gut may be the cause of constant flares in lupus patients. Lupus patients have a leakier gut and smaller variety of bacteria species in the intestines. However, a bacteria, Rhomococcus novus, is found to be 5 times more in patients with lupus. Higher count of this bacteria is found in patients with flares or kidney disease.
Lupus and the Human Body by Tiffany Williams and Ilan Fan.